Assalamualaikum and good afternoon. I know lepas lunch, whoever feels to sleep, go ahead. Tapi janganlah snore for the benefit of others. My name is, as you can see, Nur. Oh, dah tertekan. Okay, undur balik. Yeah. Nur-Run Hussein. Tadi dengar somebody said apa benda all the lettering at the bottom. I thought of starting off by giving just explanation in terms of what the letters stand for, and also my talk will be mostly in English, tapi ada mix of Malay, so just bear with me. I think because I'm just more comfortable and I think I talk faster in English. MBCHB is your undergraduate degree. So I did my undergraduate medical school at Birmingham, and then I wanted to just give a bit of background why I chose my specialty and sort of lead to the talk. After my house job, which is equivalent to, I guess, kat Malaysia 2 tahun, kat UK pun sekarang 2 tahun, but at the time when I did it was 1 year. I knew I wanted to give psychiatry a go. I'll explain why later on. And I thought the fastest way was to stay in the UK and to train, because UK is known for its psychiatric training. So I thought of getting my membership out of the way, and that's what MRC Psych stands for. It's membership of the Royal College of Psychiatrists. Kat Malaysia, if you have a membership, certain colleges, not A&E, not emergency medicine, but certain colleges, like MRCP, which Ilfita has, you kalau balik kat Malaysia, you already recognised as a specialist. And then while I was doing my membership exam, that's a professional exam, dekat Nottingham, I trained in Nottingham. At the same time, the deanery also funded my university course and to do masters. So that is masters in masters medical science and in clinical psychiatry. So that's a separate postgraduate degree. And currently I'm doing a diploma in health research at University of Leeds. So didn't put that one on. Okay. I put this disclaimer, although my husband doesn't agree with me. Just wanted to say that my advice is purely based on experience and what I've read around the subject, and I'm still training. And as Dr. Hadi, my husband, said, it's an ongoing process, it's a continuous process. So as you build up more knowledge and more experience, your knowledge will be enriched and your perspective may change. So currently I am doing what they call higher specialist training, meaning I'm not yet a consultant, sama level dengan Alhady, but kat Malaysia it has different training structure, which I will explain a bit later on. So I'm just saying that because maybe my experience currently is different from, let's say, someone who's been in the field for 20 years, or it's different from someone who's been in the field for 1 year. So it's an ongoing process. Now I know just now in the previous talk, Bang Adi said, how did you, how many of you actually want to be a doctor, and how long ago did you know that you wanted to become a doctor? So I'm not going to repeat that question, tapi my current question is, how many of you actually enjoy doing what you're doing now? Okay, that's encouraging. Siapa yang tak enjoy tu? Any particular reason? Anybody want to own up? Not sure. Don't be shy. I think we're among friends, kan? The reason I ask is because I think, personally, whatever you do, I think you must enjoy it. If you want to be successful in anything, kalau you tak enjoy it, it's become a bit of a chore, become a bit of a slog, because like medicine is a long process. So if you don't enjoy it, it's going to be a tough road for you. Even if you do enjoy it, it's going to be a tough road anyway, but it makes it easier. So, but I think if with enjoyment and interest, it makes you're more likely to be more driven, and you're likely to make more effort to learn and to get to know, do the extra bit, you know. So things become a bit easier that way. One thing though, I know it's a long 6 years course kat sini kan. I think personally the main hurdle is having your medical degree. Once you've completed your medical degree, then yes, of course, there's hurdles of jobs and progression and things like that. Tapi, you know, whatever interest or personality that you have, I think medicine is one of the few profession yang boleh cater to any needs and interests and personality type. For example, if you don't like talking to patients, you know, your options are, you can be a pathologist, or you can be an anesthetist, you know, your patient will be asleep, so you don't have to deal with patients. And if you like, the person like working with their hands, you know, plastic surgeon. So, and then people who like statistics or math, you know, there's academic side of things, or public health. So I think for me, like macam cardiology, to me that's my equivalent of medicine, equivalent to math to me, you know, because neurology, because it's logic and lots of knowledge. When I was in my 4th year, I did my psychiatry attachment, and on the first day itself, there was a mental health assessment, seeing a lady who's quite poorly in the community. And that was my first introduction to psychiatry, straight into sort of emergency psychiatry. And it was fascinating. And I've always wanted to know, I've always got interested in much of popular psychology, you know, like positive thinking and, you know, all this motivation stuff. And I think psychology and psychiatry sort of go hand in hand. And that's sort of driven my interest in doing psychiatry. So going back to, see, I lost my train of thought now. Take this with a pinch of salt. This is just for amusement. You see, it says if you're the kind of student who likes crazy patient and have a quite significant attention span, psychiatry is for you. But the opposite is true for emergency medicine. So, but just take this with a pinch of salt. And what this slide is highlight is that different. I think there's an argument whether it's nature or nurture. Tadi, you know, Alhady mentioned that surgeons tend to be a bit brutal, aggressive, decisive. Now, is it because they're made that way and they like that kind of specialty? Or is it because the nature of the training in that specialty makes them that way? And the answer is, I think a bit of both. Tapi I think the more important factor before you start looking at what kind of person, because that was asked just was how do you choose, you know, what kind of student? Was it you? Yes. Yeah. There's no clear answer for that. I think the bottom line is, you know, what you like and what kind of person, you know, you go through your attachment, you will do different specialty, and you get to know which specialty that you enjoy and which one you don't. So make full use of your clinical attachment, because that's when you have an idea of not just a theoretical side, but also have an idea how it's like to be a specialist in the area.
You can't see some of it.
Can't see.
You just need to tell what it is. Yeah.
Oh, kat bawah. Okay. If you're afraid of the light, okay. If you're sane and you're hardworking, or you're not so much hardworking and you're afraid of the light, radiology is for you. You know, X-ray and CT scan. So if you're afraid of dark, and you like to think big, it'll be dermatology, i.e. skin. That's the biggest organ, isn't it? And if you like to think small, it's ophthalmology. So Apologies for the slide. Well. So, how do you choose a specialty? Besides sort of interest, anybody else have any idea how? I know some of you have decided. Just so in the earlier talk, they know what they want to do.
The lifestyle they wanted.
Lifestyle?
Skills.
Anything? Well, there's no right or wrong answer. What do you think? Because you will be in that position where you have to choose skills in that specialty, or skills that you like to do.
Hand skills.
Hand skills.
Memorizing skills.
That too. Yeah. Anything else? Apa dia? Time. Time in what way?
Someone want to be flexible enough time.
Oh, okay. Flexible as in have enough time to do other things, fit in with the lifestyle. Yeah. So what other things would you consider? Imagine you're in your house job. Money, yes. Yes. No, you might laugh it now. I think it all can be ideal. Tapi money is important. Especially later on when you have family and things like that. It is quite an important factor. Anything else? What else would you think about when you want to choose? Because this is your life you're talking about. Because what you choose, I think it's. Once you go down a route, once you go down, you choose a specialty. Time is a factor, and swapping and changing from one thing another may or may not be towards your advantage or disadvantage. I'll explain a bit later. Anything else that you would consider?
Demand of the society.
But demand of the society. Tick tick. Firstly, I think we no longer are able to afford to just, fall into it. Meaning, gone are the days where you do different specialty and then you think, I'm talking about after graduation when you're working, and then you thought, this is the one that I like after, I don't know, the 6th job or something. I think when you're doing, I'll explain much of the training structure later at Malaysia, and I think less relevant in the UK, but more so in Malaysia. You do get opportunity to move around from one post to another in your house job. In your house job, you can dapat general medicine, general surgery, peds, I think, obstetrics and gynae, and I think that's an opportunity for you to find out more about the specialty, whether you like it or not, and whether you want a life as that specialist. Tapi also, there's other specialties that not covered during your rotation, and I think that's the one that people may find hard to decide whether they actually like it or not. But the ways of finding out. So I say do not fall into it. Siapa mentioned tadi 6,000 house officer this year? It's a lot. Now, how are you gonna? There's like mentioned previously. There's a pyramid about training. There's only X number of training jobs and 6,000 of you to compete for a job. So it's going to be very competitive. I think, especially for your generation. And you mentioned time. It's fine if you, because time, not just about time getting into a training post, but also time about once you choose a specialty, you have to consider, I'm going to have to take the exam. I may pass it the first time round, but passing rate for Royal College when your exam is about 1/3, 33%. So you have to take that into account. And then, so that's why it's important to start thinking about what you want to do. And you can also start sort of tailoring your CV and your experience toward that specialty. Some specialty, especially cardiology, is quite popular. Specialty popular? Radiology, dermatology, very popular in the UK. And you know, how do they choose from how many thousand applicants? You know, how, if you really want that job, you want that to be a specialist in the area, how do you need to make yourself stand out? And that's when people who does like a project in the area will probably stand a better look better when they're applying for a job in the area. Psychiatry was known to be least popular. It's about I think there's a lot of stigma attached to it. They call it Cinderella of all specialty, not just among the medics but among the public as well. But yet, when you still apply for, the higher you go up for your training post, the less jobs there are. There's still a lot of competition. So, you know, while some people say, oh, you apply to that area, it's not very competitive. But if you really want to be in it, you know, there's no, not to say there's no competition, there's always be competition. But, you know, one specialty may be more popular than other. Main question. This is my perspective. What do you want? So you mentioned the criteria that you thought would be important. Person. Although I put that the other slide for amusement reason, it does in terms of your personality. If you're someone quite quiet and not very sort of don't like the busyness of life, and you know, you probably want a quieter specialty, like you know, dekat UK, GP is quite popular among females because of this reason, you know. So, and then and I asked, what are you willing to do? Because, like I said, it's going to be a long slog, and certain specialty require slightly more work than others. That is all very relative. For example, I can give my example. After my house job, I realized I don't like being on call on the weekend, and doing night shift is very antisocial. So I know straight on that I want a life. So, and then I like psychiatry as well. So that's why I chose psychiatry. But some people may like shift work, because it free up some days in the week. And I think that's the thing that you have to ask yourself in terms of reality. As a medical student, you probably get a taste of it, but not a full experience of it. So you need to do a bit more. Oh, this is, need to have interest, as we mentioned. How do you choose? This is how you choose a specialty. So incentive, mention money. Another personal incentive, or some people might like to have some recognition in that area because not many people do it. Future plan and life plan. I think it's about thinking ahead. Like I said, you know, I knew that I don't want to do medicine, hospital medicine, general medicine, or surgery. I knew that's not for me. So I had it in mind that something that I can, you know, use my time for other reason. And now, for example, when I'm on call from home. I don't have to go to hospital. If the junior have any problems, they ring me. Then I might have to go in, but you know, it's easier for my life because compared to someone, let's say A&E, who have to be there for 12-hour shift, and you know, so to me, I get a better, and I get paid, we get paid the same as well. So there's no less work. So to me, it's a no-brainer. But I think, macam our GP colleague, you know, who works 4.5 days at UK, 4 days, you know, it's fairly simple about clinic, and then yeah, and you have a whole day off to do whatever they want. And again, it's a better lifestyle for them. But you know, it's different things with different people. Specialty, somebody said what is in demand. Yeah, I had a lot of slack for wanting to do psychiatry. You know, everybody said, oh, what a waste, and things like that. And then my one of my aunts kata, oh, don't worry about it, you know, it's Ahmad Jariah, because no one else wanted to do it. amateur area, meaning at least one person is doing it compared to no one doing it. It's in need basically. If you do something in need, the population in need, then you're feeling that need, you're doing something good. So I felt better when she said that, because I thought, what a reputation to do psychiatry. It's not that bad. It's really fun and interesting, honest. Personality. There is, I think I put it in another slide. There is a website. I think it's an American university, by University of Virginia or something, that you can go online. It's free. You can answer a whole bunch of questions, and it comes up with your short list of specialty. I'll bring it up later. And again, sometimes people not sure which area they should fall into, especially when it's 50-50. And sometimes it helps, because this kind of question, it just clarify what you actually want. But it doesn't give you like option A. They normally give you a list of similar kind of specialty that probably suit your need, but it depends how you answer the question, obviously. And reality. Oh, what's available and what you're capable of. The bottom line is, example, getting on specialty training and exam. Like I said, you may want to be a cardiothoracic surgeon or neurosurgeon. That's your dream. But in reality, there's not many jobs, or it's very competitive, or you need a certain grade or certain experience. In the UK, you apply to get into a training post, for example. You apply to more than one job normally. You apply to lots of jobs, and then you hope to get one. So that kind of the reality, what's going on, and what you want. Are you willing to go for it all the way and then apply anywhere in the country, or are you quite focused that actually I don't mind GP, I don't mind medicine, I'll just go where where my family are. So what can you do to find out? That's the last, the aptitude test. That's the one that's free test. You can go online. I started doing it and I thought, it's such a pain because there's lots of questions, and I thought, since I'm doing psychiatry anyway, I don't need to know because I'm already committed. So, but you can try that one out. If you find that you like a certain area, it's worth talking to those people who's working in the area. So, but as a student, like I said, you get probably a superficial view of what's going on. It gives you an idea about how interesting the topic is, but it probably doesn't give you what life's going to be like. So talk to those already working in the area. Having more experience in this field. I know kat sini you guys don't have elective module where your counterparts kat UK, they're given one rotation, I think about 8 to 12 weeks, where they can go anywhere in the world to do anything they like that's related to medicine. Kat sini apparently only surgery for you guys. Is that right? That you can go somewhere else that's not in Prague. If you have this kind of option, this is where it's worth finding out. I want to find out about histopathology. That's when it's worth using the time. And if you really like it, you can even do a project on it. And even if you don't, I think someone who really wants to find out about it, they will find ways to find time to have more experience in that field. There's also a lot of the specialist website. They have career advice for junior doctors and medical students about how to be a specialist in the area. I put the London deanery. Deanery ni macam school for specialist trainee, and they have lots of information about different specialty, but it's very UK centric lah, unfortunately. And the Royal Colleges, again, Royal Colleges are specific to UK as well. Tapi there's other colleges like in Australia and New Zealand. I don't know whether I didn't check their website, but they would have, if you Google up certain specialty, they would have information on how does it, what kind of things you need to do to become a specialist in the area. Any questions before I go on? Looking blank. You can chip in too. Anything else you want to say? No? Okay.
Maybe it's best after the presentation is finished.
Okay.
We can get the
pull it together.
Picture.
Yeah. So I don't think it would take me that long then, because I'm going to whiz through it. The next part of the talk, I think it says career development and career progression. Now I was thinking macam mana nak sort of tackle this presentation, and I come up with this sort of flowchart. I think career development go hand in hand with your self-development. Self-development, we'll talk a bit more about that. But if you're going to develop your career, you have to develop yourself. And hopefully if you develop yourself, it will affect your career as well. And this will lead to career progression. Now, choosing a specialty is a beginning. But once you start to train towards to become a specialist, that's a separate phase. And once you start a path, the training path on your specialist ladder, there's different steps within that. And in previous presentation, it was mentioned how you move from a junior doctor to specialist trainee to consultant to possibly head of department. So that's career progression. But in between, it's always, you never stop. Even if you have your specialist sort of exam out of the way, you never stop, because as mentioned before, there's always new advances, medical knowledge. So you can't give your patient information that you learned 10 years ago, because it might not be relevant. So in between, there's always a continuous professional development, which means you never stop learning. In the UK, once you become a consultant, sebab dah tak ada exam dah, one way they make sure that people are up to date is they have to prove that they're up to date. So they have to keep a file of all the activities they've done, and they have to send it to their respective colleges. And all consultants have to do this. And this stems from, I don't know whether you guys heard of Harold Shipman? You hear? Harold Shipman. He was a GP dekat North Leeds, where we are. He was a GP, and he was found to be guilty in, he essentially murdered his patients, all patients with lots of morphine, all people. And they lost track. I don't know how many patients in the end, but he was found guilty, and then he killed himself in the prison. But anyway, because of him, that people, all this issue about how do you prove, once you're a consultant, once you're a specialist, that you're up to date with your knowledge, and how do we prove that you are competent in your area. And that's one way of UK that's actually moved towards all consultant being they call it revalidated. So kat Malaysia, although there's I don't know, I'm not aware of any system to, once you're a consultant or specialist, to filter whether you're up to date with your knowledge or whatever. But I think regardless whether they have a system in place or not, it is your responsibility to keep yourself updated. I put here in terms of how do you, to progress in your career and to develop your career, you have to know what is expected of you. I.e., as a student, how many of you actually look at your syllabus? 2 orang, 3? Or a few? Okay. Because, why do you guys look at your syllabus? Any?
Main reason is because of exams. What to cover, what we can leave out.
Yeah, exactly. Because otherwise you'll be learning everything in the textbook. You don't need to know everything in the textbook, although it's good to know, but I think realistically you're not able to retain so much information. And same goes, I think it goes throughout your training, in terms of knowing what you're supposed to do, because there's no use of doing things blindly and then realize I say, you know, I didn't do this and kena buat lagi, you know. So if you're in a training program, I think it's probably, I'll start drawing about how the training structure at Malaysia is like. They have their syllabus, they have their expectation of what you're supposed to do, and they have a certain assessment process, and you have to know. But just currently, if you take your exam, what's your process besides studying for the exam? Do you do anything else? I know you have lots of exams, but the main exams. Do you do anything else besides studying your notes?
Football.
Watching football?
Yeah.
To rest, okay. You need to have life work balance or study balance. You guys talk to your seniors? Yeah? I heard that you do. So talking to someone who's gone through the process saves you a lot of work. In my membership exam, I spoke to people who've gone through it, and they said, oh, you must do this, you know, read all this article here, you know, and it saved me a lot of work instead of studying about everything, because syllabus is quite, although it's quite specific and useful, it's also about the technique, and passing your exam is about technique. It's no point learning theory, reading it in your textbook when your exam is MCQ. Oh, I said also, although you need to achieve certain objective, if you have something else like sort of personal that you want to achieve, let's say I'm interested in General Adult Psychiatry, meaning I'm interested in working with adults between the age of 18 to 65. But I enjoy the subspecialty area of women, mental disorder in women after childbirth, like Meroyan. I don't know whether you've heard, but yeah. So although your syllabus said this thing, but I'm quite interested in that area, so I'll probably I've done my attachment working with a specialist area, specialist consultant in that area. And I read around it, I did my project, my MSci project on it. So, although, yes, you have to feel your objective, you can make it personal to you. So it makes more sense and it's more interesting. And now because I spent 2 years away from a non-training job and I'm back in training post, I'll explain about that soon. It's so much fun because I can do whatever I want, because I'm given a day to do whatever I want, and it's more interesting. It make my job more interesting, and I don't think it's such a chore. So you can personalize it. I don't know which board would be better. So, kat Malaysia, let's say you graduate. Can you see? God, I have to draw it right bigger. After you graduate, you spent 2 years as a house officer. I don't know, is that what? Houseman. And I mentioned about the specialty that you have to do. General medicine, general surgery, peds, obstetric. I'm sure I'm missing something else because it's emergency medicine, because it's 2 years, and I think it's 4 months rotation, if I'm not mistaken. After that, people become a medical officer. And this can vary from a few years to many years. And this is when you become a bit more responsible. And if you talk to MO, there's more of a junior MO and more of a senior MO. So it depends on. That's why I say it's a big range. It's just someone can just go into MO, someone who's been there 7 years. Tapi in Malaysia, to get into specialist training, you have to have done, I think that they quote about 3-4 years from, I think it's graduation, Evan. Is it graduation? Or MO? MO. Also called the Master's program. Now, to get into a specialist training, I said just now, it's quite competitive. That's why a lot of people go through 3 years minimum unless you know someone. And it depends on the field, because sometimes you can put your preference, but they might just give you a specialty that you thought, I don't really like this, but I have no choice. So that's what I meant in terms of competition and what's available. Master's program is 4 years. Then you do, like, you have exams, but in your final year you have to produce a dissertation. And after completing your master's, you become what they call a specialist. Tapi your training doesn't stop there, because you still have people on top of you, but you're known as a specialist now. You can probably open your own clinic by now. So if you're thinking about GP or anything else. Tapi I mentioned about Royal College punya membership exam. They have certain criteria. Depends on the specialty that you're doing. For example, for psychiatry, in order to take the first exam, you must have at least 1 year experience of psychiatry. And to finish your membership exam, they have part 1, part 2, part 3 now. You must have at least 3 years experience in psychiatry before you can move on. For Royal College of Physician, MRCP, sekarang you can take as soon as you graduate, I think, the first exam, and then they have a just scope. So in theory, you can finish all your exam within a few years of your graduation. So this is a local master's program in Malaysia. Membership exams. There's many different colleges. We call it colleges, but it's actually not a college. For the UK, for example, there's Royal College of Psychiatrists, the College of Emergency Medicine, Royal College of Anaesthetists, Royal College of Pediatrician, etc. You get the point. At Malaysia, there's nothing to stop you from taking membership exam, provided you meet whatever the criteria is. The limiting factor will be money, because it's costly. I think if you take one exam, will set you about 1.5 months of your wage. I think about 3,000 ringgit good. And also time in terms of taking time out to study and time out to do the exam. If you get your membership exam in Malaysia, it depends on the specialty. That's why you have to find out what specialty you want to do. You can become a specialist. So that's another route. A lot of people hang around medical officer for years and years and years, and you might be happy with that, maybe because you're happy with status quo, and maybe it suits your lifestyle. Tapi I think it's a bit of a shame because it's part of development, isn't it? And part of you're supposed to progress. And yes, you can just give. You can give to the community being a medical officer. Don't get me wrong, but you know you're here and you're capable of doing a lot more than that. So that's how the training process goes. You want to add anything? No. Career development and progression also depends on, I mentioned about the assessment process, appraisal, oh sorry, go on.
What's the difference between those two?
What's the difference?
I mean, pro and con.
Pros, you're in the local system. I think in terms of, it takes, I think in general, should I put it, time and trying to get trying to get a training spot. Training spot at a master's program depends on availability. They have a quite restricted number. I don't know, I think it depends on specialty. And then, like I said, it might take you at least 3 years of being an MO before you're being offered a master's program and you have to apply for it. But it might be that they give you a specialty that you didn't even consider, or you didn't really want. So that's the cons. Membership exam. If you know that's what you want, it's probably a shortcut to master program. Tapi bear in mind, the membership exam depends on which college you do, which country. Is it UK based, Australian or New Zealand? They are biased towards their own trainees, meaning if you work in NHS or the UK, it's easier for you to take the UK when you're college exam because you're familiar with the system, especially in sort of your clinical, and I think you know sort of how the game is being played, So the advantage of the membership exam in general, if you're Malaysia, I'm talking it from once you're in Malaysia, is that potentially it's a easier, faster way to become a specialist, but it will cost you because it comes from your own pocket, and it also depends, like I said, time factor. Tapi I think you probably have more say in what you want to do. If you want to do MRCP and that's what you want to do, we're else waiting for a master's program. You might get it, you might not get it. I think that's the difference.
Well, for specialist training, we don't have to pay anything.
It's part of in that 4 years, you kerja while studying. And normally you'll be in that 4 years, you'll be seconded or you'll be attached to one of the teaching hospital like UM or UKM or USM. And then, so you'll be working at the same time of studying and producing your dissertation. And tambah contract. Yeah, your contract will be, because it's part of the contract with the government lah. They let you studying here, when you balik in Malaysia, you have to work a certain number of years. By going through that training program, you add extra number of years to your contract. Okay.
In terms of the skills and expertise, is there any difference between these two ways? In terms of the skills required?
In theory, shouldn't, because both are specialist exam. Tapi obviously Malaysian punya system is different from UK or from other. Let's say UK emphasizes a lot in terms of communication, how you treat a patient, things like that. That's in terms of would you call it soft skills? As opposed to sort of clinical skills. Tapi kat Malaysia, if you want hands-on, you have lots of opportunity. But whether, I think depends where you are and who your seniors are, and also how you make full use of your posts. You have opportunities, but in terms of maybe at night, you're probably less supervised, and the same is in the UK as well, so you're a bit more autonomous and independent. So I think in terms of experience, kat Malaysia obviously more like infectious disease someone mentioned that you're probably not exposed to kat tempat lain. But skills in general?
That's a good question, because this is why membership Royal College of Surgeon is not recognised kat Malaysia, because it's skills related. Because by definition you're just sitting exams. Malaysia only recognise the one that is knowledge based membership exam. Psychiatry, medicine, pediatric. The skill, as in what you have to do related membership exam in Malaysia, is not recognised. For the skill related specialty, Malaysia only recognise the fellowship, which is another exam that you can only take 4 or 5 years after the membership exam, which is the exam I'm taking now, which is the fellowship of emergency medicine. Surgery, there's a fellowship of neurosurgery, there's a fellowship of orthopedic surgeon, there's a fellowship which is another exam. So all skills related specialty, in other words, you need to do things, you can't use this shortcut. There's another loop down there, another 4 or 5 years down there that's not in the picture.
Or should I put certain specialty?
Okay, so a membership exam only works for knowledge based specialty. And for physician and pediatrician, when you have the membership exam, you are not only a general physician specialist, you are not a gastroenterologist or respiratory physician or dermatologist. Whereas the master's program in Malaysia is straight away, you know, gastroenterologist, dermatologist, respiratory physician. So it's already very special. So even after the membership exam, if you want to be a general physician in hospital, yes, you are specialist general physician. But if you want to be a gastroenterologist or dermatologist or respiratory physician, you have to add another year or two, either in Malaysia or somewhere else, to get the recognition as the specialist. So people use the term specialist and subspecialist interchangeably. Some people say the specialist is general medicine, the subspecialist would be dermatologist, you know, but no, it's all really, you know, specialist. You know, people say emergency medicine is specialist and intensive care medicine is subspecialist, but it's actually not. It's just two different specialties. So yeah, another to consider which way you do this is recognition in Malaysia. So all the skills based in general are not recognized unless you have the fellowship, not the membership. And the fellowship, you have to add another 4 or 5 years on top of the membership.
I hope that clarifies things. But the other sort of routes in terms of training kat Malaysia is either with Kementerian Kesihatan route or through university. I know some of you who are sponsored can work with the government, but it's just a slightly sort of different pathways in terms of who pay your salary and your career progression. I'll mention a bit later. Going back in terms of appraisal and assessment, it was mentioned that self-reflection is very important in terms of, you know, what do you need to do, how else, what are the gaps in my knowledge and my skills that I need to fill in. During the break, I spoke to some girls about being aware of opportunities. If you're here, there's lots of opportunities around, and just sort of being aware and open your eyes to them. Meaning, for example, when I was doing my membership for psychiatry, I know Nottingham training Nottingham also offer masters in clinical psychiatry. Now I don't need to do that, but you know, it's being paid. You know, I get paid to go to the course. They pay for my tuition fees. I get a degree at the end, and I jump at that opportunity. So in the end, I got 2 postgraduate, my membership and my masters. So it's knowing, you know, knowing what's around. Another example. Currently in Leeds, I mentioned I'm doing the diploma in health research. I heard my friends were talking about it. I said, oh, how do you get funded for it? And then they said, oh, if you work with the NHS, they will, in the area, they will pay for you. So it's free again. You know, I don't have to spend any from my pocket. I get a qualification at the end. I took opportunity. So it's about identifying that and making, you know, full use of your chances and your experience here or anywhere. I mentioned about talking to seniors and ask their advice. There's a hard way and there's easier way, and I always think easier way is probably my preferred route. And you know, people, your seniors gone through the hard way or maybe easier way, but they are the best sources. They can tell you the best way to approach things, shortcut, what they learned from their experience, what worked, what didn't. There's a lot of workshops out there. I don't know how it is in Prague. I guess this could be considered one of them, but no, not really. But no, seriously, there's in the UK there's a lot of career workshop that they advertise. That's one way to find out about that certain area. And you have to develop for career progression, certainly in the training system that we've experienced in the UK, it's not just about clinical knowledge and skills, it's about this area as well. We mentioned, you know, I think teaching was mentioned just now, and you know, yes, we never run away from teaching. You know, you see one, do one, teach one, you know, the motto. But I think you teach more than one. And in fact, it is part of our system of appraisal. You have to prove that you've taught other students, and you have to show evidence for this in order for you to pass your yearly assessment. Mentioned about management and leadership skills, and it was mentioned in previous talk about how it should be start developing now. Research. Not many people do research. It's not an easy thing to do, but if you do, it looks, especially if you're vying for academic career in university, that's what you should aim for. Proper research, not just survey, not just audit. Do you guys have to do audit here? No? Do you know what it is? No. Do you know what research is? Yeah. Audit, people get confused. I think the general term, you know, people think audit is research, but audit is basically you look at already a set standard. Let's say, at UK, the government, the Department of Health may have a standard of care for all patients with schizophrenia who's on antipsychotic medication. You must monitor their blood sugar, for example. That's a standard. And then you look at your practice, clinically, what's happening. You look through your patient's notes and to see how many of them actually get that done. And then you compare to what you should be doing and whether you need to work on it. So that's audit. It's about comparing your practice with some standard. And research for another range. You can do a simple survey, which is not exactly a research survey. You send out question, yes, no, percentage, and give you some sort of answer. But research, actually more proper study research, like clinical trials, you know, case control study. You know, that's proper research. And as a student, you should have lots of opportunities to do that. In fact, if you get publication based on your research or your project, you know, it's like super bonus point on your CV when you apply for jobs, even kat Malaysia. Yeah. So I'm sort of explaining the different sort of training structures. I think to go into a different specialty would take lots of time. So if you have any certain specialty in mind, we'll try to answer them. But in general, that's roughly what it looks like if you were to go back home. And previous talk we mentioned about networking. You know, you develop your career by, sometimes you work very hard and you're good at what you do, but you're not good at networking or PR, and maybe you don't progress as high as someone who's quite politically apt. So, and that's how life is. You know, I think unfortunately, career progression and having good sort of skills, people skill and political skills could be an advantage. But anyway, it depends on what kind of person you are. I mentioned about continuous professional development, about we never stop learning. And part of it is what we call peer group. I think it's more of a UK-centric concept in which once you become a specialist, like I said, how do you know that you've updated your knowledge? And one way to do that in the UK is that as a consultant or as in a non-training post, you're expected to have to be in a small group of people who may be of similar specialty and similar sort of grade. So if you're a consultant, it should be other consultant. And it's like a study group in a sense. Tapi the difference is you're not studying together. The difference is that you are looking at each other punya objective for the year. So you discuss like, oh, this year I need to work on my management. How do I go about that? Do I need to go to courses? Do I need to take up more responsibility? And your peers, the other people in your group, will say, yeah, that sounds like a sensible development plan. And then they could give advice as well. And part of this peer group, at least in the UK, you have, it's one of the evidence to show that you're up to date with your CPD, your continuous professional development. Because in the UK now, the consultant has to prove to the General Medical College, Council, General Medical Council, the GMC, which is, I guess, the main regulating body for doctors, that they're up to date, and that's how they do it, through peer group, through CPD. Kat Malaysia, like I said, I don't think there's such system exists, tapi it's still really useful to have a group of people that you can sort of check each other progress and development. Because after you leave school, siapa nak check? There's no exam. It's up to you whether you want exam. If you don't take exam, that's fine, and you won't progress in your career. That's one way in terms of making sure that there's always some form of development. Okay. And more in detail, in terms of Kementerian Kesihatan versus university, you work in the government hospital, Kementerian Kesihatan, you can be posted anywhere in the country. Could be in Sabah, could be KL, could be in Penang, and you probably go through that structure. If you work with a university, meaning you're aspiring to be an academic, I think you can enter at any stage. I think you still have to do your house job. You can start off with being a lecturer. You still do your whatever specialist training, tapi you're bonded with the university, meaning you probably spend a lot of your time teaching as well. You still can get your specialist exam, but majority of your time subsequently will be, I think, a lot of teaching to medical students and things like that. And I think from talking to our friends, some people want more stability in life, so that's why they join universities. About at least they're posted to one area. That's one advantage. But also you can move up the career ladder. Tapi dia punya requirement a bit different. If you work with Kementerian Kesihatan, you're essentially a government servant. As a government servant, just like teachers, just like I think policemen or whatever, you have your kemahiran. Every few years you have to take this exam to pass before you can progress, naik grade. I forgot what's the name. Penilaian something. Yeah. Is it? Yeah. That's the one. Whereas in the academic world and in university, you don't have to take that kind of exam to progress. Tapi there's academic expectation. If you want to be an associate prof, you must publish at least 3 papers in a established journal. And sekarang, my friend working with UMH said that she has to produce at least 1 or 2 papers a year in a peer-reviewed journal. So there's a lot of pressure in terms of producing and publishing things. So that's slightly different pressure. So I end with, because I'm like a firm believer having a goal, because at least I can time myself and maximize my time in this world. Hopefully it will be useful in the next. But anyway, so I think all of us should have a goal in mind, because otherwise, how do you hope to know where you're going? And you might spend time wasted when you could use that productively. Okay, any questions?
Yeah, for people that values stabilities, flexibilities in time, maybe no conflict, probably. So, what choice of career path that might be available for them?
If someone said it again?
For someone that value flexibilities in time, maybe they value to spend time with family or spending time doing activism. So, what kind of career path that is available for them to choose?
I think
in terms of maybe specialties also.
Yeah. Let me start from, in terms of kat Malaysia, unfortunately, walaupun the female workforce is quite high, we don't have the luxury of what they call flexible training kat UK. Like, kat UK you can work flexible, work part-time essentially, even when you're a doctor, because they've trained you so many years. It's a little rugi lah not lose such resources. Kat Malaysia, unfortunately, there's no such option. I hope there'll be one by the time I get back. But the idea is giving you flexibility about time, life, work balance, and especially for young people. So unfortunately, there's no such luxury kat Malaysia. So looking into what kind of specialty that will give you, I think that's where you start looking in terms of, if you're a specialist or a consultant in that area, what are they doing now? For example, when I was doing my PEDS house job, I really want to do PEDS, but then I realized, oh my god, a consultant pediatrician kena datang pukul 2 pagi, even when you're a consultant. And they would talk about the consultant having to be on site. And I thought, that's not what I want. So you have to find out, if you're a specialist, a consultant or whatever, how is your life going to be then? Because some specialty, the more senior you go up, like psychiatry, the easier it gets. Like I mentioned before, I'm doing my own call from home now, and it gave me a flexibility. I can put my children to bed, I can watch TV, I can do, laundry, that kind of thing. So I think knowing which specialty gets busier and which specialty doesn't will be useful in terms of which specialty will suit you better. Unfortunately, during any training bit, it's going to be busy. So I think there's a bit of sacrifice to be made during your training. But then it's only how many years of your life compared to another 30 years of your life. So I think during the training bit is just a bit of sacrifice. But then after that, you have to find out how life would be like once you're a specialist in the area. The answer macam tu, I think GP has quite easy life. In terms of they do lots of clinics, but then they're probably a bit more flexible, especially if you own your clinic later on. Besides psychiatry, I think things like A&E, they work in shift, so that would never change. Or as a consultant, I don't think it gets easier. Pediatrician doesn't get any easier. Some surgery, general surgery, vascular surgery, you get called out, as mentioned before. Neurosurgery, also busy, so depends. Retinal, different specialty. I think it all depends. I think you need to find out which one. But people tend to view mainly GP and psychiatry as an easier option.
The other good specialty to go into if you want time is histopathology, microbiology, biochemistry.
Oh, excitement.
Academic teaching, dermatology, ophthalmology. Okay, basically the specialty that does not have major emergencies are all stable specialties that when you are a consultant, you just basically sit at home. Half the time you don't even know that you're on call because you just don't get called.
Because your juniors will do them.
Every now and again, when I have to call a consultant biochemistry on call because there's some weird blood results that nobody can understand, they say, "Am I on call? Have you checked with switchboard?" "Yes, you are on call." Because they're not even, because they're just so rarely called, maybe 2 or 3 times a year or something. Okay, but then again, it goes against the grain of some people becoming a doctor because you don't see patient anymore. Certain of those specialty don't see patient anymore. The one that see patient are dermatologists and ophthalmology, and these two really don't have much out of hours. Radiologists used to be like that. Radiology used to be, you know, once you're home, you don't need to come in. But modern medicine relies so much on interventional radiologists now. The way of the future is radiologists have to come into hospital more and more often.
Yes.
Kak Nurrun ada cakap the most important thing is we enjoy what we are doing. So let's say that after a few years you found out yang tersilap ambil specialist ke something kan, and then how would we make it enjoyable? Like, you have any advice?
I think depends on how far you go down the route when you realize, ooh, tersilap. Because if you know, there's still some flexibility before you masuk sort of training in terms of finding out which one. Tapi let's say you dah like a year before your master's program completed and you realize, oh no, this is not what I really want to do. There's always, say, being not just teaching, you probably required to manage your department or your juniors. You know, you're probably expected to do things for, sorry being UK centric, but you know, at UK there's the colleges, so you can be active in terms of setting up the syllabus for the training, or being active in the political side of the specialist area. So a lot of people sort of branch out once, you know, so you're not just focused what clinical, seeing the same patient all the time. I think that's the advantage that we have. Yeah.
Oh, and I forgot to tell you, modern medicine have changed so much. Even though all we've been talking about so far is hospital and GP medicine, but there's more and more opportunities out there for medical legal work, medical journalism, medical research with pharmaceutical company, medical outreach with charity organisation, Médecins Sans Frontières, UNICEF, UNESCO, all these things, alright? So there is a lot of medical work who's actually now gone away from hospital work or medical work. Okay, so if you find yourself in microbiology training because you think, oh, this is 9 to 5 and I have a lot of time, and then suddenly near, you know, halfway or towards the end, you find that, you know, you don't like looking down the barrel of a microscope, you know, 8 hours a day, then you may decide, oh, I'm just going to jump slightly to the side into epidemiology, take some extra, you know, statistics qualification, epidemiology, you know, research of diploma, and then I say, oh, I've jumped a little bit from microbiology into the epidemiology, and then, oh, and then I can apply some work with health planning with you know, in ministry in Malaysia or something, and then if you think bigger, oh, now we can go work with you know, UNICEF or UNESCO, you know, we can go and help develop, you know, third world, you know, the windows is open. Medical degree is more than just being a doctor nowadays. Medical journalism, people are going into left, right and center into medical journalism, becoming writers, you know, go to, you know, I don't know, go Palestine or something, write about healthcare system in Palestine, in Israel, or even do your monthly, you know, medical bulletin journal. Who is better to write in a medical journal than doctors? You tell me. Do you want to read a medical journal who's been written by some do you know what I mean?
Yeah.
right? And then medical legal work is another, you know, medical legal work is more and more medical legal thing. All you need to do, some of my friends who've done it, you know, they've finished medical school, they go into GP or whatever, and they find, oh, they don't want to do this anymore. All you need to do, invest another 2 to 3 years, take a law, you know, degree, you know, by that time hopefully you would have some saving. You know, you can do law degree and then part-time you can locum at the GP in Malaysia, you know, get per hour, you can still have family, you can do night classes, weekend classes, whatever. After 3-4 hours you get medical degree and then you can be a medical defense lawyer, medical complaint, you know, whatever. There is infinite.
And I was going to say that kat Malaysia you actually have 2 weeks leave kan, dia bagi yang not including, you can do like volunteer doctors with mercy and things like that, and that's not accounted as your annual leave or your sick leave or whatever, that's extra leave. And I think it's mostly teaching hospital that does it, dia bagi, you know, so you have that scope in terms of doing you know, volunteer medical work with certain organizations. So there's a variety that you can do that's related to medicine but not necessarily in your specialty.
I mean, like myself, I do foresee, for example, if there's big sporting event like Formula 1 or rally or whatever, they would need a cover by, you know, emergency physician. Sometimes if they do Olympic, you know, big sports events, if you're into, you know, sports medicine, musculoskeletal medicine, you can register and be a physician for Majlis Sukan Negara or whatever. You know, the scope here is, you just don't know it yet. Do you know what I mean? You can even create your own as you go along. It doesn't really matter. You can even be a food hygienist, become a doctor, and then start you know, eco-friendly farms. I don't know. You know, just let your imagination run wild. It doesn't really matter because it is relevant. It's applicable. I think they like to use think outside the box. Definitely, that the terms will apply here, especially even more so as there are more and more doctors in Malaysia. Even more so, use your opportunity here to pick up skills and knowledge that is outside the box.
Medical degree is valuable in the sense that I said, you know, it has a lot of transferable skill. You don't just learn about your theories, but you learn about presenting yourself. You have your oral viva all the time, kan? Like so, you know, presentation skills, your IT skills. And some people, you know, go into other fields that doesn't seem to be related to medicine, like into city banking, UK, or you know, totally non-related to medicine because they have that transferable skill.
Oh, I forgot to say, who else is better to design a hospital IT system that regulates patient flow than a doctor? Who knows why patient needs to be there? You know, if you're into computer, you're on Facebook all the time, then think about expanding your skills a little bit more. You know, might be useful in the future, inshallah.
Yep.
Speaking about the branching pathways for specialist training, if you know what are the restrictions placed on government-bonded postgraduates for the MRCP route, because I would assume, let's say you apply for MRCP London, you have to go to, you know, London, right?
There's for all the membership exam, there's different components to it. Normally, the theory bit you can take that in Malaysia even, and I think they run a few times a year, if I'm not mistaken. The Fita may know. But yeah, so it depends. Normally, the theoretical component, whatever membership exam, you can do it anywhere because it's MCQ, you know, theory based, knowledge based. But it's normally the clinical bit, which is normally the second part of any exam. That's when you probably need to have a bit more experience in that setting. Some people do, when they know that they're taking their clinical exam, they come a month before, a couple months before, they try to arrange an attachment somewhere just to get a feel of what's going on and how the system works and things like that, and then they take their exam. You can certainly do that. I think a lot of people do that if you don't work in that setting. So that's one way to go about it. But there are a lot of people in Malaysia that has membership exam, and there's nothing to stop you from asking to practice with them because they've gone through the process.
Yeah, but my question is about, let's say you are bonded like us, 10 years. Are there any special things that we are not preferred to do, like, you know?
I think no one can stop you from your own sort of development. But I think in terms of the contract, if it's made clear that you need to be bonded for 10 years and you've done your 3 years and you got your membership, maybe you're, it's probably your responsibility to fulfill the other 7 years, either in whatever way, either through more experience, more working experience, or pay them back. I think in terms of, there's nothing to stop you from taking it. I don't think,
yeah, it should be alright, because what some people have done, they bonded for 10 years, and 3 years into their work in Malaysia, they go and sit MRCP, and they got the MRCP, they come back to Malaysia, they say, I'm already MRCP, I'm already a physician, so give me a higher post. So you apply for higher post, you continue working in the kementerian, and you complete your contract up to 10 years, and no story, there's no problem there. But most people, after they get MRCP,
unfortunately,
yeah, they leave, for better cash in the private sector. Alright, this is another big subject, don't get me started sort of thing.
I think because yesterday I was speaking to Hamimi about even a lot of you not so sure about the healthcare system in Malaysia. It's probably another. Do I have any time to roughly go through it? Yes. Yeah. So in general, this healthcare system in Malaysia, there's the public, i.e. hospital kerajaan. University falls sort of under hospital kerajaan, and there's private. That doesn't fall anywhere. Okay, so a lot, hospital kerajaan, anybody can have access to it, but it's heavily subsidized by government. If you work with the government, you may have extra incentive in terms of tak bayar banyak, or just pay RM1 for your prescription, things like that lah. But if you work sort of privately and you access hospital government, you may have to pay a bit more. Tapi it's heavily subsidized by the government. Kat Malaysia, you all have experience going to GP, you shop around. Those are private. Also, things like SJMC or Ampan Putri, that kind of is private. And kat Malaysia now, a lot of people have private healthcare insurance, and they either access it through their insurance or they have to pay from their own pocket. In terms of what you get from private versus government, in theory, it should be the same. But obviously, one has limited resources and the other doesn't. We can go into ethical problems because private hospital or private healthcare, we personally don't think it's well regulated, meaning there's no one to check their standards. They can charge you a lot for doing not much. In fact, we've heard sort of anecdotal stories about how unethical some places can be. Not to say that government hospitals are any better, because it depends on, but I think government hospital in fairness are very short staffed. There's a lot of junior doctors, but not many specialists remain in the government sector. There's not enough incentive for them to stay in there, and money is one of the big reasons why there's exodus of doctors from the government going to private. So sekarang, what you find is government trying to fill up the gaps in medical energy by filling out all the junior doctors, but they forgot to fill in the gaps about the exodus of doctors going to private. So that's in a nutshell about, yes, we have two systems kat Malaysia, and sekarang there's talks about introducing healthcare insurance. I don't know how far it got. It's just a hearsay that there was a plan for macam kat sini kan you guys pay insurance. So I think there's talk, because obviously limited resources, how are you gonna provide the best healthcare when you don't have, you have limited resources? There's been talk about that, but I don't think they have proceed further on that. Yeah. Tapi if you want more details later, you can ask. Yeah.
But also, aiming aiming to be in the private sector could also be one of your long-term objective, and this is commonly done for personal reason, but for monetary reason, you know, it doesn't really matter. I know a lot of physician doctors who works in the private sectors. They work in private sectors because they want to have more time, because they can work less hours but they get as much money or maybe more, so that they can use the rest of the time for charity work, for, you know, religious work, for community work, or even for, you know, for their own family. So you know, which sometimes in the government sector you don't get that time. You're busy. But then again, in the government sector and university sector, you contribute to the community because it's already, you know, a sector that contributes to community anyway. So it depends what you need, regardless what your long-term goal is. It's all good in the end. As I say, is have the idealism, you know, in your head, and you know your objective and you achieve it, and then you have, you know, the right intention, you know, and then you get for your family, you get for your people, you get for your community. Hopefully, you know, you get rewarded accordingly. So there's so many ways to approach things. You can start thinking about it, or you can not think about it, and then eventually you get there as well. Inshallah, I think it's just we are just all very aware that sometimes when we start talking about different health system, especially in Malaysia where there is unregulated private healthcare system, it becomes very sad when every now and again, or quite often, you hear stories that they go to private hospitals and they get everything done, whereas it's not necessary, because they just claim from the insurance company. You know, on the other hand, you go to the government hospital, as Kak Nurrun said, you don't get anything done because it's too busy, and you don't look too ill, and everybody's busy, and there's more sick patient, you know. So the balance is definitely not there. But hopefully this is why we are all here, to try and improve the future, inshallah.
This question yesterday, but I got to this question, so I want to come back.
Okay.
Soal apa pandangan doktor tentang effectiveness of traditional system? Because here in Czech Republic, we are having traditional system. Is it difficult to adapt when we are back there in Malaysia? And then second question is, what's your opinion about overseas graduates that are not efficient?
That are not
efficient.
I think the first question I can direct to you, because you answered that question yesterday about traditional versus integrated.
Traditional system is very good, it's excellent, provided you remember everything you learn. There's nothing more perfect than that. You remember everything you learn, you know everything you've done in the last 6 years, you come out the other side, there's no better doctor you can treat me, right? Unfortunately, we are human. We are insan, isn't it? Do you know what that means? What does that mean, insan? That's right. It's an Arabic word. It means, it used in Quran as a human, but it's also got a second meaning, which is forgetful. Alright? So it's been defined upon us that we forget, but we know that anyway. So that's why most universities in the UK, in the US, in New Zealand, Australia have changed to a more integrated system. They start teaching less basic stuff, so much less, alright, so much less, to a point that when you graduate, like myself, because I went through the very new system, that you hardly know any anatomy, you hardly know any pharmacology, you hardly know any physiology when you graduate from medical school. But having said that, most of the learning that I have done in terms of anatomy, physiology, anatomy, I did it after medical school. So the 3-4 years after I graduated medical school was the busiest time of my life, was worse than when I was at medical school, because I had to learn all this again for the membership exam. Alright, so if you've gone through traditional system and you remember all these things, by definition you can sit the membership exam in your house job. As simple as that. But unfortunately we don't make it. But having said that, people that traditional system normally doesn't suffer so much in that 3 years, because to you is revision. To me, I had to learn from scratch. But it's fortunate because I can concentrate my learning. I only have to learn things that's related to emergency medicine. I don't have to learn everything. I don't have to learn Harry cell, you know, whatever. I don't have to, you know, I bet you get quiz on that, you know. You know, alright, so, you know, it's so it is good, but it's you know, just don't, you know, just have effective note keeping. You need the notes again for your membership exam, especially those doing MRCP, pediatrics, you know, MRCS, you know, the surgery, the pediatric obstetric. Make use of your time studying this, having a powerful note, so that 4 or 5 years down the line, if it's not on there, it's in your whatever cards, whatever.
So that answered the first question, integrated versus traditional. The second question is about being effective doctor.
Non-efficient overseas graduate. Competent doctor.
What's my personal opinion? Is that the question? If it's a personal opinion, there's no, I think, whether you're overseas or not, whether you're doctor or not, the question is, are you making the fool of your, see my motivational side coming out, whether you're making fool of your life or not, full stop. Yeah, whether you're making, you're maximizing your chance and opportunities and life and do the best that you can do. So I think if you're not effective or efficient, I think you rugi. That's my personal opinion. Whether you're doctors or not doctors. I think more so being a doctor, you have to develop the skill to be efficient and effective. You know, like when you study, you have to learn, like I said just now, you know, yes, you study hard, you learn the shortcut or learn the most relevant thing, so you can the end product is more effective, you know, than having to go through the long hard slog. I like the shortcut myself. Tapi it's about, I think kat rugi lah kalau tak, you know, especially if you're here, you're in a privileged position, being overseas, having experienced other things, and not making full use. I think it's a bit sort of a waste. So don't let it go to waste. I'm just referring back to you because you're equivalent.
I didn't actually understand the question.
Now, what do you think of?
I don't know. I don't know for us.
Alright. I don't know whether does that answer the question.
I don't.
Okay. Anything else before? Take time.
Oh, just a side. Do you think forgetful is a good trait or a bad trait?
Could be good, could be bad.
Okay, we know it's bad in one sense. This is just a side. Why can it be a good trait, forgetful? Sorry? What's that? Somebody answer.
Can remind.
Sorry?
Because we forget something. We need to forget something that we do not want to remember.
Yes, okay, yeah, because we are our life, you know, as doctors, you know, you have to learn to forget very quickly, because some of the things you see and you experience in your life, you know, in your career, looking at nasty things, people death, bloody things, head blown off and all these things, certain things you need to forget very quickly. Alright, so forgetful is not such a bad thing. It's bad if you can't remember what you have to study, but it has its use, which is why it's only described in Quran. It's not described in a bad or in a good manner. It's only described as that, forgetful, because it's got its good point. You need it. If not, you know, if not, God won't give it to us.